Chronic kidney disease usually develops when someone is in their 40s or 50s and progresses to end-stage renal disease when they are in their 60s. So especially for our younger donors, we cannot be 100% certain that the donor will naturally progress to end-stage renal disease in the future. Living donors are at higher risk of developing kidney failure if there is trauma or damage to the remaining kidney, as they no longer have a backup kidney. The progression from chronic kidney disease to end-stage renal disease may also be faster, and once the donor is in end-stage renal disease, they will need dialysis or a transplant. If the donor requires a transplant at any time after donation, they are given priority on the wait list according to the current United Network for Organ Sharing policy. There are some additional considerations for women who plan to have children after donating a kidney. There is an increased risk of developing preeclampsia or gestational hypertension, both conditions involving high blood pressure during pregnancy that can negatively affect the mother and fetus if untreated. However, a 2015 study found that there was no increase in preterm birth or low birth weight in previous kidney donors. There were also no maternal deaths, no stillbirths, and no neonatal deaths among the donors, so the study concluded that most women had uncomplicated pregnancies after donation. If a pregnant donor has specific concerns, we recommend they consult with a high-risk obstetrician for closer observation. While medical information obtained during the living donor evaluation is kept confidential, just like any other medical records, any infection that requires reporting is an exception. Infectious diseases such as HIV, hepatitis, and cancer, if found in the donor during the first 2 years after donation, must be reported. The donor would be informed of the results, and the recipient's transplant center would also be made aware. If the donor is donating directly to their intended recipient, then the post-transplant team would be informed. If the donor donated through the paired exchange program, then the transplant center that received the kidney would be informed. The transplant recipient may also be told about the results, especially if the recipient requires treatment or additional monitoring. UNOS now requires transplant centers to store blood specimens on all donors for at least 10 years after donation. This blood will likely be drawn just before surgery while the team is placing your IV, but must be drawn within 24 hours before donation. The samples will be stored at Mass General. All donors are tested for HIV, hepatitis B, and hepatitis C at the preoperative visit, but these blood samples can only be used if the recipient develops a kidney disease that may have come from the donor where additional testing is needed.